lesson on computed tomography. Computed tomography, or CT scans, are narrow-beamed X-rays that use a motorized rotating scanner to create cross-sectional images to make more of a 3D picture, where you can view these to see inside of the body and help diagnose disease. So let's discuss the purpose of a CT scan. So the doctor will order a CT scan to get a clearer and more detailed picture and help see if there are any abnormalities or signs of disease in the patient's body. So CT scans are going to show tissue and help to detect tumors, right? So they show organs, like in this picture over here. You can see some organs right here. It's kind of a cross-sectional picture here. And they help to diagnose disease like pneumonia or heart disease. They show vessels and any clots that are within them, and complex bone fractures may be seen with these that aren't visualized in regular X-rays. Now let's talk about what to do before the scan. So when the doctor orders a CT scan for your patient, just make sure you explain the procedure and why they're getting it. For example, if the patient's D-dimer was elevated and they're short of breath, the test might be ordered to look for pulmonary embolisms in the lungs. Sometimes the doctor is going to order a CT with contrast, in which case you're going to need to get a formal consent filled out and have the patient sign it. So check and make sure the patient's had a lab draw for bun and creatinine, just to ensure that their kidney function's okay, because this contrast can affect the kidneys. The radiology tech is not going to be able to do the test until you get a formal consent done, because the contrast is invasive. It's going to go into their IV. The contrast could be inserted IV or PO, and if it's by mouth, they're going to be drinking it, and they need to drink it 2 hours prior to the test. Why would they need by mouth contrast? Well, that'd be to look at the GI tract. And then I usually just mix it with some Sprite or something to hide the taste. The patient's going to drink the contrast, and then you're going to call and let radiology know. Say, hey, they just finished the contrast, so 2 hours from now we can do the test. So during the CT scan, you're going to help to position the patient on the table like right here, according to the test ordered. So if IV contrast is going to be used, you need to disconnect any lines that are connected to the patient so that the radiology tech may administer the contrast. Ask the patient not to move during this test so we can get a nice clear picture. So after a regular CT scan, there aren't any special considerations. The radiologist is going to interpret that test. The doctor is going to inform the patient of the results. It's really important to know that if contrast is used during any test, metformin has to be held for at least 48 hours after. Okay, this is going to help us to avoid any kidney damage. Now let's move on to patient education. Make sure you explain the importance of staying still during this test so we don't have to redo it. A warm sensation might be felt during that IV contrast insertion, almost like they're peeing when it's being put in the IV. Notify the patient when it's okay to resume their metformin, especially if they're going to be discharged shortly after and have to worry about that at home. So the priority nursing concepts for a CT scan are patient education, safety, and patient-centered care. All right, let's review the key points. So a CT scan is a more detailed 3D X-ray that's ordered by the physician to view tissue, vessels, organs, bones, and that helps to diagnose disease. So before the test, you're going to inform the patient of what they're having and why they're having it, right? If you're going to use any IV or PO contrast, you're going to need a formal consent filled out before they will do that test. During the test, you're going to want to position the patient and disconnect any lines if they're going to have contrast. After the test, I want you to make sure you hold metformin 48 hours after the contrast if they have metformin. And if they're going to go home, make sure you educate the patient on this. That way they don't hurt their kidneys. That's it on CT scans. Now go out and be your best self today, and as always, happy nursing.